Hi, this is Dr. Eric Codner with Southwest Georgia Center of Medicine and Colombus Physical Medical Center in Columbus, Georgia. And we have many patients who complain of fibromyalgia, and they ask us, hey, Doc, what is this thing? Is it my doctor acts like nothing's really wrong with me. I think my doctor thinks it's in my head. I hear this so much, and it's saddening to me because these people are really suffering with a real condition, this fibromyalgia, chronic fatigue syndrome. And I tell them, well, the doctor may think it's all in your head, but I think it's all in your brain. And there's a difference between the two. The doctor thinks you're making it up or that you're hypochondriac, whatever. I think your brain is not firing properly. The brain becomes very sensitive to pain, and even when you touch someone, that sensation shouldn't be painful, but to someone with fibromyalgia, their brain perceives it as painful. Even though there's no damage being done, they feel like they're being bruised every time. There's no bruise, but it feels like it because their brain has their brain is functioning in such a way that pain is heightened. They typically also experience problems sleeping. They typically will have energy crises. Sometimes they'll be hyper. Most of the time, though, they're too low. They're very tired. That's where the chronic fatigue comes in. Brain fog is a very common symptom of this. They just can't think straight. They can't remember things. They jumble their words. They lose things frequently. Very sensitive to medications and chemicals. We find that there's many different ways someone can develop fibromyalgia. They can have hormone issues. They can have weak adrenals or adrenal gland dysfunction. They can be exposed to certain toxins that can lead to nervous system damage or brain damage. It can be directly from brain damage. You hit on the head, a bad whiplash accident can lead to it. Upper neck C1, C2 misalignments can lead to fibromyalgia, chronic fatigue. We see a whole host of soldiers at our Columbus location. Fort Benning is near. Those soldiers have been exposed to God knows what chemicals. We see that all the time in our soldiers, the fibromyalgia, chronic fatigue cases. It can come on due to severe emotional trauma. You were beaten as a child, or spousal abuse, or you're in a war, saw violence. That can trigger it as well. So what happens though is your brain is physically firing differently. So you have to physically fix that if you want fibromyalgia to go away. And there's ways to do it. Your brain needs energy, your brain needs nutrients. You got to find the right combination of nutrients, of treatments to fix the problem. And we have done it very successfully on hundreds of patients, and it works. Is it perfect? Is it that person never ever going to have a symptom again of fibromyalgia? Probably not. Probably they're going to have maybe a bad day in the future, but it doesn't have to be every day. Most days they're going to feel good. If they get off track, they don't do what we tell them down the road, it could come back, sure. Once the brain gets kind of a program, you can think of it like a computer, like a programming bug, like a virus or something in a computer, because your brain acts like a big computer. It could rerun that program in the future. So I'm not saying this is this magic cure-all, but if you get the body functioning right, it wants to be right. It'll stay that way as long as you're doing the right things. So we can show you those right things to do, whether it be IV therapy to get those nutrients in you, big enough amounts to make a difference in the way to change the brain. There are nutrients that pass through the blood-brain barrier to get to the brain to actually help it heal. There are definitely oral supplementation, herbs and things that can help correct the adrenal glands. That's how your body deals with stress. Then there's lifestyle changes. You got to sleep. You got to maybe give up that job that's stressing you out. Maybe you got to find a new husband or wife that's not abusive to you. This is real life. You got to fix the problem wherever you find the problem. You got to find it, you got to fix it. And we're real with patients about that. So we've had these deep discussions with them, and sometimes that's what it comes down to. So you gotta be willing to face what's wrong and fix it. So if you're suffering from fibromyalgia, chronic fatigue, maybe the doctor hasn't diagnosed you with it, but you have all these symptoms I mentioned, the fatigue, the tiredness, the weird pain that makes no sense, give us a call. If you're near Americus, 229-389-2038. If you're closer to Columbus, 706-330-1389. We're going to talk more about functional medicine. Be sure to check out our other links about functional medicine, and we're going to put more out on fibromyalgia and chronic fatigue as well in the upcoming future here, in the upcoming months. So until then, this has been Dr. Codner. Thank you.